Okay, so we're actually looking at the physiology of labor. We're looking at the physiology of labor. Okay, so physiology of labor here, it should be more of like, okay, how labor should actually go on in the right way. Okay, so physiology of labor, so that it's an orchestrated biological process. It involves the mother, it involves the baby, involves all the hormones that play a role in labor. Okay, so of course all these themes are coming up so that childbirth can be a thing, right? So it's not just all about contractions, it's a cascade of the changes that are preparing the body to be able to deliver the baby safely and effectively. So for the various things we consider in the physiology of labor is the hormones first of all. So estrogen and progesterones are usually coming in, okay, so that the uterus is relaxed more. So estrogen levels usually go up when it is about time to give birth, okay, so they makes the uterus more responsive to contraction signals. Oxytocin released by the posterior pituitary is what usually causes a lot of contractions to come in place, right? So prostaglandins too, they are produced by the placenta and the fetal membranes. Prostaglandins help to soften the cervix, okay, enhance the contractions in the uterus. So fetal cortisol increases late in pregnancy. This is what stimulates the placenta estrogen production. This is what promotes labor, okay, labor towards childbirth. So maternal and fetal contributions is cervical ripening, so the cervix should soften, shorten and become more elastic, usually driven by prostaglandins and enzymes that should break down collagen. So myometrial activation, so the uterine muscles become more excited and much more sensitive to oxytocin. So fetal positioning, so the fetus typically assumes a vertex position, that's head down position, okay. So pressure from the presenting parts on the cervix, so the head, the pressure on the cervix is what helps to thin the cervix, what helps to soften the cervix, and also stimulate. So labor will now be further divided into first stage, which is cervical dilation. Second stage is delivery of the baby. Third stage, after the baby is out, you have to deliver the placenta and its membranes. Then the fourth stage is have to take care of the woman after the delivery of the child and the placenta. So physiology of labor, the overview, this is how things should go on normally.